Good morning. My name is Louise Hart of Henrico County, representing the Virginia Society for Human Life, and we support this legislation. Thank you.
Thank you.
Mr. Chairman, members of the Committee for Strength Family Foundation, we also support this bill.
Anyone else in support of House Bill 62?
And I also, I'm sorry, Catholic Conference is also in support. They have advocacy day, and they can't be here, but they're also very much in support.
Thank you for that information. Anyone in opposition to House Bill 62, please come forward.
Good morning. I'm Melanie Gerhardt. I represent the Virginia section of the American College of Obstetrics and Gynecology. They do oppose this bill. There was a doctor that was supposed to come today, but then knows how that goes. So I'm giving his short blurb. Economically disadvantaged women should not be forced to bear a child with severe and incapacitating birth defects because they lack the resources to pay for an abortion. State funding in these cases represent compassion to women in distress.
Thank you. Yes, ma'am.
Hi, thank you so much. Good morning. My name is Kathy Grenier. I'm the director of the Patricia M. Arnold Women's Rights Project at the ACLU of Virginia. And the ACLU strongly opposes House Bill 62. Every woman's situation is different and many things can go wrong in a pregnancy. No woman plans to have an abortion, but if she needs one, every woman deserves the opportunity to make the best decision for her circumstances. While we all may not feel the same way about abortion, we should agree that women and their families should have access to safe and affordable health services, especially in a medical crisis. Abortion is a private, personal decision that should be left to a woman in consultation with her doctor. It is not a decision for politicians to make. House Bill 62 would restrict access for very poor women, resulting in a system where only wealthy women can access the full range of healthcare services in the face of a devastating prenatal diagnosis. House Bill 62 would deny poor women access to safe care for no other reason than their poverty. Leaving poor women without financial assistance for safe and sometimes critical care threatens their well-being. These low-income women are by definition, because of the financial criteria, very poor, and House Bill 62's denial of care would exacerbate the crisis for those of them who decide they want to terminate their pregnancy. If House Bill 62 is approved, low-income women in Virginia will have no option for a pregnancy in which the fetus has an incapacitating physical or mental anomaly. This bill targets a small but significant group of women. House Bill 62 would repeal funding that's invoked in only truly dire circumstances. The ACLU generally opposes restrictions on the coverage of abortion care, but House Bill 62 is a particularly cruel manifestation of such restrictions. It applies by definition to women who are unable to afford medical care, and when a woman receives a catastrophic prenatal diagnosis, she should have the option that her wealthier counterparts enjoy to end the pregnancy safely and with dignity. House Bill 62 would force her to scramble for money she does not have and therefore quite possibly carry to term. That is no way to treat a woman in a medical crisis. Thank you.
Thank you very much. Anyone else speaking in opposition to House Bill 62? Thank you, sir.
My name is Sam Bortle. I'm on behalf of American Academy of Pediatrics. We would like to say that you need to consider the consequences, situations where a mother's child carry a child with severe birth deformities, long-term care, and requirements to manage those kids and care for them. It's a drain of resources for the family and for the medical community as a whole. The question of abortion is between this, we're not going to touch on, but the question is the consequences of what can become an issue and it's allowed not to happen. Very easily. Thank you.
Thank you. Mr. Go ahead.
Mr. Chairman, if philosophically you believe the policy should be that abortion should be allowed only in cases of rape, incest, or preserving the life of the mother, would it be a correct policy statement that this measure is an extension beyond that underlying premise, and that state funds could still be extended if a woman was in any one of those three circumstances if we passed this legislation?
Counsel.
The code section authorizing the use of funds in cases of pregnancy resulting from rape and incest would remain untouched in the code.
Thank you. Yes, ma'am. You're waiting to speak.
I'm sorry, my name is Termina Keene. I'm the Executive Director of NARAM Pro-Choice Virginia, and I'm here to oppose the bill. I just wanted to comment just briefly about the question. Abortions in cases of life, rape, and incest is under the Hyde Amendment that's mandated by the federal government. The fetal anomaly exception that we have on the books here in Virginia has been there. My understanding is since abortion became legal. So I just wanted to put that out there as well. But thank you so much for giving me the opportunity to speak this morning. Today, Medicaid-eligible women have access to abortion care only by very narrow exceptions, like rape, incest, and fetal anomaly. Delegate Cole proposes what I consider one of the most callous and shameful bills filed this session, as he wants to rip this last safety net out from under women who are already marginalized, so we can save, and there's an impact statement here, of less than $15,000 a year, and it impacts less than 24 women. Pregnancy is a very precarious condition. Every day women are given devastating news about a much wanted pregnancy going wrong. Like Christy Brooks, who lives in Stafford, was eagerly awaiting her second child when she received some devastating news. At her 20-week ultrasound, where she would find out the gender of her unborn child, she and her husband were told that the little girl was suffering from a terrible deformity, one she would not survive outside the womb. The condition prevented the fetus's lungs from forming. Upon birth, she would suffocate immediately. Christy and her husband sought 2 other medical opinions and agonized for days about what to do. They were told there was no hope, but Christy could either terminate the pregnancy or carry the pregnancy to term for another 20 weeks. But no matter what, she would not come home with a baby. Christy and her husband reluctantly decided to terminate the pregnancy. In the end, Christy told me it was the only rational and compassionate decision that they could make. Because Christy was in her second trimester of pregnancy, the procedure was more complicated and more expensive. And luckily, Christy and her husband had insurance. In the end, the hospital bills reflected $15,000 in charges. Christy only had to pay about $1,500. Being a one-income family who had just purchased their first home, this would have financially devastated a young family. But what would they have done without the insurance coverage? I ask that you not repeal the fetal anomaly exception for Medicaid and for Medicaid recipients and protect women and their families. This is the only coverage that they have. This is their safety net. Give them the tools to make the best choices for themselves and their families. There are more Christies out there, and some are Medicaid dependent. Please don't pull their safety net out from under them. Thank you so much.
Thank you. Jessica.
Good morning, Mr. Chairman and members of the subcommittee. My name is Jessica Honke, and I'm the Director of Public Policy for Planned Parenthood Advocates of Virginia. I'm here today in opposition to HB 62, which is a callous bill that repeals the section authorizing the Board of Health to fund abortions for women who meet the financial eligibility criteria of the state plan for Medicaid in cases in which a physician certifies that he believes the fetus will be born with a gross and totally incapacitating physical deformity or mental deficiency. I would like to also share a story regarding a woman's difficult decision to end her pregnancy because of a fetal abnormality. In this case, her insurance paid for the abortion procedure,